It's my honor to welcome you tonight to the alumni and current student panel to reflect on the 50th anniversary of the Renaissance School of Medicine at Stony Brook. The span of experiences and changes that these 50 years encompass represent some of the most profound changes medicine has known. 50 years ago, there was no COVID, no HIV, no SARS. 50 years ago, fewer than 10% of the physicians practicing in the United States were women. 10% of medical students were other than white. And shamefully, the Tuskegee syphilis experiment was still ongoing. Things have changed a lot in 50 years. Entire fields of organized medicine did not exist, such as emergency medicine or geriatrics. Imaging we rely on every day, like CT scans or MRIs or echocardiography, were unavailable. Our understanding of the genetics and molecular medicine mechanisms in disease was rudimentary and not clinically applicable. And our approach to medical training remained very much an apprenticeship model. Much has changed, and some things have more to go. What you'll hear tonight are the reflections from our earliest graduates to our current students of their education at Stony Brook and how that education has reflected the sweeping changes in medicine through this period of time. You'll also hear what has remained constant, how the centrality of doing what is right for our patients has remained at the heart of everything we do and everything we teach. And you'll hear anecdotes which illustrate the success of a noble experiment that our School of Medicine can innovate and create new generations of physicians where they did not exist previously. So I hope you all sit back and enjoy these fascinating and thought-provoking reflections of Stony Brook School of Medicine through the years.
Thank you.
Thank you so much for that, Dr. Wertheim. My name is Caitlin Monroy, and I'm a fourth-year medical student, and I'll be the moderator for tonight's panel presentation. Thank you all for joining us this evening as we look back in time to celebrate 50 years since our medical school opened its doors to 24 students, 16 men and 8 women. Our panelists today graduated from Stony Brook School of Medicine, now called Renaissance School of Medicine, and they each represent their half decade within the 50 years. Each physician will speak about something memorable during their time as a student at Stony Brook, and by the end, you'll have heard snippets about all 50 years and how it produced our world-class practicing physicians. I ask that everyone please remain muted, and if there are any questions, so please put them in the chat. We have a packed agenda for you this evening, but we'll do our best to get to your questions once all panelists have spoken if there's time at the end. And if you're on social media, we would love to hear from you. I put our Twitter and IG handle in the chat. Be sure to use the hashtag RSOM50 when posting. At the end of tonight's panel, if the alumni on would like to continue reminiscing, which I'm sure they will, we will have breakout rooms based in which half decade you graduated. So let's get started with Dr. Lucy Palmer, Associate Professor of Medicine and class of 1979. Dr. Palmer, can you tell us what was most memorable about your years as a medical student and how did that influence your career today?
Yes, I can. I want to share my screen. Can I do that?
Jeff, can you go ahead and do it?
I see me, but never mind. Now we're good.
I'm here.
Okay. Everything blacked out. Okay, just give me one moment.
We're seeing it.
Okay, is that the right size? You see it? Or do I need it bigger?
That's fine.
You can see it.
Okay, so I have the distinct honor of being a member of one of the earliest classes. In fact, the 5th class of Stony Brook Medical School at that time. And of course, I am one of the alum who came back to Stony Brook. I returned in 1991 to be a faculty member in the Division of Pulmonary and Critical Care. So what was our class like and what was different at that time? First of all, I want to share my personal experience of medical school admissions in the 1970s. I was a senior at Smith College majoring in cell biology, and my career was going to be in marine biology until it wasn't. What I really wanted to do was to go to medical school, but I was not applying because I thought being admitted as a woman would be too challenging, I'm embarrassed to say. I was turning away from the pathway I wanted because of my perception of medical school admissions. And that is how I felt in 1972, my senior year. Medical school could not happen. Fortunately, a friend of mine supported me in my aspirations, and my attitude became confident, and success followed. I joined the 5th class at Stony Brook, and we were a group of about 45 to 48 students. We had been rounded up by Jerry Green, the admissions officer. He wanted applicants who'd been out in the world, seen life outside of college, and perhaps might have a more circumspect view of life to bring to our physicianhood. On this slide, you see the future hospital. This is how it appeared when we were students, a place to be filled someday with patients and memories. Our classes were on South Campus, where the dentistry is now, and we had our classes in what we called the trailers. We were a lively group. We were a rebellious group. I remembered, with the help of Dr. Al Jordan, thank you, Al, we had a lively class demonstration outside of administration. We felt our schedules were impossible. We had long commutes to multiple sites all over Long Island, including Queens and even the Bronx in some case, but we still had a home base in Stony Brook. Here you can see the harsh conditions of our classes. Here we are going off to Mineola and struggling to get there. We were a tough group, as I said. I have no recall how things changed after that demonstration. I believe the boats are gone. We are also a socially committed group. I remember some of the class work devoted many, many hours to working with migrant farm workers to improve their health conditions. But how were our classes different from those of today? Well, what about the lectures? They were often done with overhead projectors. The faculty would write and draw on transparent sheets, and those images would be projected onto the wall. Subsequently, we did have chalkboards, and even carousel slides. Here is a photo of one of the early classrooms where we are getting instructed in the heart sounds. You can see like we are all connected like an octopi to the patient in the center. I remember doing a lot of hands-on work. If there was urine to be analyzed, we went to small labs dedicated to that purpose. We would spin the urine down and look at the sediment. If a patient had pneumonia, we got the sputum and made our own slides, hoping excitedly to see gram-positive cocci in pairs and chains and make a diagnosis of strep pneumonia. If our patient had DKA, we took their urine and analyzed it with the assistance of a colorimetric test for ketones. Every couple of hours, we would crush little tablets, mix them with urine, and compare the color to that on a chart. This would determine the amount of the ketones. If it was time to present, we would run to many different laboratories, hematology, chemistry, immunology, and pick up little pieces of paper. Those were the test results. What were the teaching sites like? This is a large open ward, which actually these wards still existed in the 1970s. In Queens Hospital, there was such a ward. And when I did my first surgical rotation, we did a vascular rotation in a room such as this. What we would see, which you don't see here, because it's just meant to be a cartoon of sorts, is all these men lined up. They would have their socks off. They had their pajama legs pulled up, and we would wander from bedside to bedside, looking at gangrene, open wounds, fresh AKAs all over a very short time. It was a very intense experience. So these are some of the experiences that differ from today's students. But what are the foundational experiences that affect all of us, no matter what age we are training in? These differ for each of us, but are fundamental experiences that affect our decision-making and point our careers in different trajectories. When I was a fourth-year medical student, I took an elective at the Brompton Hospital in London, known for its excellence in chest medicine. The first experience I realized there was that nurses were in a different position to many of the nurses in the United States. This scene particularly almost looks like one of adulation. The nurses at that hospital would wait upon the physician's hand and foot. Every day, the nurses would serve us tea and cookies in the afternoon after rounds. Now that was not the life-changing experience, though that was rather astounding. No, as an impressionable fourth year, I was amazed and enraptured with the exquisite physical exam these British MDs performed. Such attention to detail was an elegant act to try and model. So pulmonary was viewed in a very special light. Also, the Brompton had a pulmonary museum of hundreds of lungs preserved in bottles where you could see every type of infection, cancer, and immune-related disease. All this made pulmonary very exciting and enticing. But there was another more emotional experience that affected my career. Here you see the typical sanitarium of the early 20th century. They were used for treating tuberculosis. These are people taking a cure in their beds, lying outside in the fresh air, more commonly directly in sunlight. And this was thought to be a method of healing the tuberculosis lesions. When I was a toddler, my mom was in one of these sanitariums. And on Sundays, my father would drive my sisters and I up in front of the main building at Uncas-on-the-Thames, where she lived. We would open the car window and she would wave to us from the building, and we would wave back. And that was the visit. And then we would close the window and drive home, missing her badly. Well, that experience certainly influenced my interest in pulmonary, and specifically pulmonary infections, for the rest of my life. Sometimes, unpredictably, pulmonary disease comes as a pandemic. Here you see several physicians dressed for the COVID onslaught. We would witness all the pulmonary manifestations that it brought. Who would have known in 1975 that in 2020, this pandemic would change everything about the way we look and see and experience our patients? What will be next? Thank you.
Thank you so much for that, Dr. Palmer. Now we will hear from Dr. Sharon Nachman, Professor of Pediatrics and Associate Dean for Research and Class of 1983. Dr. Nachman.
Okay, thank you. I hope you can see me.
Yes.
Okay, so I'm sorry. There we go.
We can see you.
Now you see me. So first of all, I wanted to say a shout out to Bill and Lucy, because I keep hearing that theme about infectious disease. And as everyone knows, I'm the division chief for pediatric infectious disease. And I want to say what goes around comes around. We're always going to need infectious disease physicians. And thank you for those shout outs there. Stony Brook, when I joined, was well known to attract students from non-traditional academic backgrounds. Often, these students were older, more mature, and more experienced in life. And then there was a second group of students. We were the younger kids. We were from Sophie Davis. We had very few life experiences. After all, we went straight from high school into a combined college and medical school curriculum. For example, when I started in Stony Brook, I had to learn to drive because I was a city kid. I didn't own a car, didn't drive, and all of a sudden, here I was at Stony Brook and nothing was near public transportation. So in those years, we learned to move from our clinical rotation to our clinical rotation. We learned how to develop skills that would help us to succeed. And most importantly, we learned to be lifelong learners along with all of our classmates. And this lesson was one that I took to heart and made sure that I followed my directors and said I would read one new article every single day. So as a frequent user of the library, yes, the library was where you found books and you looked up articles and you stayed around to try to copy them because you couldn't take the books home or the journals home. And I came across an MMWR report talking about a very few cases of pneumocystis carinii pneumonia. It occurred in men on the West Coast who frequented bathhouses. And I went, I am never going to be worried about this. I'm never going to see it. I don't have to think about it. And it's just not going to impact my life. After all, I was going into pediatrics. Well, obviously, I was 100% wrong. And that disease, HIV, is something that not only changed my career trajectory, but pretty much changed everything we learned in medical school. And it changed all of our lives forever. Moving forward from that one report, I want you to remember how HIV changed all of our lives, from research into clinical care. There were so many firsts for us. All of those firsts, I want to say, got us ready for the SARS-CoV-2 pandemic. We practiced on the HIV stuff and we were ready for SARS. This included everything from diagnosis to treatment to prevention and pretty much everything in between. Never before did the Senate earmark millions of dollars to fight an infection. HIV was first, taught us that we can go to our Senate and legislators and say, we need money to fight a disease. And we want it specifically for that disease. We learned it in HIV. We repeated the message in SARS. We learned how to wear PPE. Those very few cases that we saw initially, no one knew how HIV was transmitted. And I remember going into rooms in full, I guess what was PPE then, a little bit different than it is now, but certainly the same kind of total cover up. Don't let any part of your body be exposed. It was difficult for us, and it was difficult for our patients because they had no idea who we were when we walked into a room. We had to develop new medications, all the while looking back at medications sitting on a shelf. Could we successfully repurpose them? So between picking up something called AZT that was languishing on a shelf by GlaxoSmithKline to prevent HIV transmission from mother to child, we learned how to develop targeted therapies. And those lessons learned are very accurate today. The Pfizer drug being used now to treat patients as an outpatient for their SARS-CoV-2 includes a protease inhibitor, ritonavir, that we tried in children in the 1990s. And how could we make the diagnosis? Well, we couldn't make the diagnosis of HIV. We had to send bloods up to the mothership or CDC and kind of hope we'd get a result. We had to learn how to do rapid testing, how to do PCR testing, that word didn't even exist, and how to do point of care testing. Here we are with SARS-CoV-2 and having learned the same lessons over and over again. So in short, lessons we learned early on are repeated often in our medical careers. And we still know what we learned then will be valuable today. So at Stony Brook, I want to remind everyone we were, and we continue to be, at the forefront of medicine. And being a clinical trial site for all of the HIV care in the past, we are now a clinical trial site for all of the COVID today.
Thank you so much for your insights, Dr. Nachman. Our next speaker is Dr. Marcia Tannenberg, Currant, Associate Professor of Clinical Psychiatry and Class of 1989. Dr. Tannenberg, Currant.
Hi, my name is Marcia Currant, and I remember distinctly that driving out here in 1985 to start med school. It was quite an experience, you know, to come out to Long Island, also from the city, see nobody out walking. And I wasn't used to suburban life. It was also different. But ultimately, you know, despite the architecture of the place and that it was really at the time a lot of concrete and a lot of unnavigable spaces, the people were pretty terrific. And that's really what made the difference. So aside from a detour of maybe 2 years, my length of stay at Stony Brook since arriving as a medical student is 35 years, which is pretty notable. So it's a lifetime. And I came as a medical student, I stayed as a psychiatry resident, and then I came back as full-time faculty. And when we were talking about what topics are we going to discuss, the only one that I could think of was, why did I stay exactly? Because it was a long time. And primarily it was because of family. That's the reason I stayed for my psychiatry residency. But I really would not have stayed here had it not been for Dr. Gregory Friccione. Some of you will know him, most of you won't. But Greg, which is now what I can call him, was then the division director of the consultation liaison psychiatry division. And I did an elective with him in med school, and it was really so edifying, and really watching him, because he was such a good doctor and he was such a humanitarian. When he tried to convince me to stay, because he was going to be the training director if I stayed. And he told me, you'll fit in with the faculty here, you'll fit in, at the hospital, and, you'll just become sturdy, steady, the best psychiatrist you can become and the best doctor you can become. And I believed him, so I stayed. And really, I don't think I ever looked back. Anyway, so I thought I would tell you about him. I convinced me to stay. I stayed. So I Googled him. And this was sort of a funny thing. So I Googled him, and he was where I last saw him and spoke to him, which is that he's a professor of psychiatry at Massachusetts General Hospital. And he's there, the head of their division of medical psychiatry and a bunch of other things. But anyway, they had on his page on the website, they had a link to an excerpt of a lecture that he gave at the hospital in October 2020. And it was the name of the lecture, I think, was something about preserving your mental health, 5 tips for preserving your mental health during a pandemic. And so, of course, I had to click on it. And there were these tips, and the first was really about all the connections and attachments that you have to people. And the second was maintain your commitment to your values. And I looked at that and I really smiled, because of the work that I've been doing for the last 6 years. And about 6 years ago, there was, everybody became aware of a crisis in the mental health of trainees in medicine. And graduate medical education and Dr. Wertheim and the hospital saw to it somehow that there'd be funding for free and confidential counseling that the hospital would offer to any resident and any fellow. And that's what I've been doing. Not totally, but almost totally. So when I read this thing that Dr. Patricia Eng had written about maintain your commitment to values, I thought about it, because over these years, I would say that about half the time that anybody comes to see me, it's really because they're finding it tough to navigate their values in being clinicians. And so we talk about it and we try to realign them and figure out, what they can do about it, and maybe did they understand it properly, whatever it is. But values are just so key to clinical medicine. So here I am 35 years later, and he's up in Boston, I'm here, and I, only see him briefly at conferences. And I thought, well, I must have really learned something in Stony Brook. I must have learned that constant that Dr. Wertheim was talking about, which is how important it is in clinical medicine, the values that we have, because it's really, first of all, our values are challenged so much in 2022, and we have to figure out what they are all the time and what the balance is. And for those of us who are on the faculty, doing what he did for me, which was to model those values and try and figure out the balance and fight for those values, is something that he did, but all of the faculty did for me, really.
So thank you so much, Dr. Currant. I really can attest to how much mentoring is so important at Stony Brook, and I really appreciate you sharing your words with us. And next, we have Dr. Todd Griffin, Professor and Chair, Department of Obstetrics, Gynecology, and Reproductive Medicine, and class of 1993. Dr. Griffin?
Hello, everyone. So nice to see everybody. I'm going to try to do this a little differently. I'm going to talk a little about the faculty that we interact with, talk a little about life for Stony Brook during the time I was here, and then a little about what was going on in the world. So I think one of the things that was most important for me at Stony Brook was this was the first time I really interacted with faculty and got to really know them on a personal basis. We never really had that, I don't think, in college or anything like that. And I think, my first real, I guess, mentor was Dr. Jack Stern. And I'm so happy to see that he's here today because, it was interesting that how that relationship changed, meaning that, he was my professor and I obviously wanted to do well. We were all hard chargers, but it was almost to the point where I just didn't want to disappoint him. I wanted to do well and have him be proud of me, almost like a parent. And, I think that was something that I will take with me forever. I think, I think everybody who interacted with him will tell you the same thing, that it was just really a powerful experience having Jack as your teacher. And then I was lucky enough to obviously be a resident here. I did leave for a few years when I was in the Navy and then be back. And it was wonderful to walk around the hallways, even as a resident, a faculty member, and see Dr. Stern. And he would always say, "Hi, Todd." And he would always ask me whether I'd graduated medical school yet, and I was always like, yeah, 15 years ago, 20 years ago. But either way, he always remembered me and always had something nice to say, which was good. And so I'm really happy to see him here today. I think the other faculty member that was really impactful for many of us was Dr. Fred Miller. And I'll never forget the first day of pathology class, sitting down in class, and Dr. Miller was up in front, pacing back and forth, and he would call on us by name and look at us. He actually had memorized the entire class roster and would say, "Mr. Griffin, what do you think of that?" And I remember getting that the first day of class and being like, oh my God, I'm in a much different place than I ever thought I would be, and realized that I was going to have to step up my game. So, I think just the two of them, I just wanted to highlight them as people that were truly impactful. I think the other thing I would remember as a medical student is that there was no work hours. When we were in clerkships and other things like that, we had to be there before the residents. We left after the residents. We worked every holiday. There was no Thanksgiving off, Christmas off, anything like that. So really the transition to residency, I think, became more about volume of patients as opposed to work hours, which I think was important. And then I just wanted to highlight a few of the things at life at Stony Brook. I think real quickly, I think most of us from my era will remember the park bench and Thursday night hospital nights. I think most of us will remember our first and second year potluck dinner that we used to have, where we would, roast the different faculty members. That was a really exciting time. And then one of my fond memories is we had a band that actually played at potluck called, we had multiple names, but it was called Dude Fish. And I just want to shout out to Bill, Gus, Jay, Lloyd, Al, and Ron, the whole crew that was part of that band. And then finally, I'd say the last thing I remember was the cottages down on West Meadow Beach, where we used to be able to hang out. One of our fellow students actually had a house there. We used to hang out there a lot. And then really just from, a world perspective, the things that were impactful for us, I think was, one was impactful for me was Desert Storm. Was occurring during that period of time. It was the first time we really saw, missiles going into places, and we would be huddled around our TVs watching Desert Storm and really being tied into that. And who knows whether that impacted me being in the Navy for a few years, I'm not sure. And then I think the other final thing on a lighter note was The Simpsons came out, and we would all make sure every Sunday night to get together and watch The Simpsons. And I think mac and cheese was the favorite thing. So for me, Stony Brook has been truly impactful, and I've been here my entire career. And I want to thank you guys for giving me a few minutes. And I look forward to talking to some of my classmates.
Thank you so much, Dr. Griffin. That was great. Next up, we have Dr. Kara Harth, Associate Professor of Neurology, Program Director of the Neurology Residency, and Director of the Neurology Clerkship at Stony Brook, and class of 1998. Dr. Harth?
Hi, so my first day of medical school is where I met my husband at the barbecue at the remnants of the Sunwood Estate. At the time, we had the dean became Dr. Norman Edelman. We also played in my first year something called The Game, which was this weird kind of a scavenger hunt that was orchestrated by Ben the Clock Tower Samstein. I have to mention that the stroke unit opened up at Stony Brook in 1993. ReoPro was approved by Barry Collar. I thought that Lucy Palmer's picture with the scaffolding was amusing because I don't know that I've ever seen those towers without some scaffolding. The changes in technology, you've already heard people mention a little bit. email? What email? If you needed an email, you had to use like the one computer in the library or the dean's office, and who knows who was going to get it because we weren't emailing each other. Then there was the Y2K panic about what was going to happen with all the computers. We had computers that had a touch screen. You needed a pen to get results. And there was no EMR. We rounded with all the paper charts on the big cart going from room to room. We also, the slide carousels, the overhead projectors, the note service, and the note service was optional. You paid to have the privilege of transcribing a note, and then the next day you would get a paper note in your mailbox. So there was no 360 or echo or any kind of a recorded lecture. And how about films? There was no packs. We had to run downstairs or all over the place looking for the actual hard copy of a film and find a light box or a window. And MRIs, you had to take a paper order and walk it downstairs to MRI and hand it to the tech. There was no C-base. There was no digital anything. When the students registered, I actually have a picture that I found in my yearbook. This was the lottery. So every single clerkship position was written on the board, and the entire class was actually in the lecture hall, and people would shout out where they wanted their rotation and what site and what month. Now that's all digital. Clerkship years, you would go out to dinner with your attending at the end of that clerkship week or end of the clerkship month. That hasn't happened in years. We also had the decade of the brain. We had what was the scariest epidemic at the time, West Nile in the end of the 90s. And that was like, oh my God. Or variant CJD and mad cow and the UK variant. Or when N95s were used for TB. And as Dr. Nachman mentioned, you could probably count how many HIV drugs there were on the count of just your one hand. And then the last thing is less of a happy memory, but a little bit about mental health and wellness, that we did lose Rick Brooks in that period of time. And I'd like to think we've made a lot of headway in recognizing mental health and wellness, particularly as a result of COVID, for both medical students and faculty. That's all I have to say.
Thank you so much for that, Dr. Harth, and that is so true. Next, we have Dr. Jason Kim. He is our Associate Professor of Clinical Urology and graduate of the class of 2003, excuse me. Dr. Kim? Do we have Dr. Kim on?
Dr.
Sorry,
Kim.
I'm mute myself. Yeah. Okay. Listening to everyone else, it was very interesting. Dr. Palmer mentioned using transparencies for lectures. Well, when I first started, we still use transparencies. And, just like Dr. Harth mentioned, I think during my time, there was a lot of technological change in the School of Medicine. Most of us came into school, I think very few people had cell phones. There were a few in my class. I think a lot of us were still on dial-up modems at home. I remember when they first installed wireless internet in the pathology labs. That was an exciting day, and then we could work on our laptops. And actually, we spent most of our time studying, I guess, downloading free music on Napster, things like that. I remember seeing my first iPod from one of my friends while they were studying there. Our note service still was on cassette and transcribed, but I guess the difference from Dr. Harth is I think we could, at that point, once we transcribed it, we can actually download it off the internet. And I think it was during this time that we first started using PowerPoint. My first PowerPoint presentation was in medical school. And, since then we use it every day. But I think looking back, the biggest memory I have of medical school actually was 9/11. I remembered very clearly. I was actually a third-year medical student on the surgery service, and I was actually part of the trauma service at the time. And I remember we were in the middle of rounds, and we were in a patient room watching the TV and seeing what happened. And after that first plane hit, everyone was very shocked. I went down to the medical student lounge where a whole bunch of medical students had gathered and watching on the TV, and there was a lot of uncertainty about what was going on. some classmates had relatives who worked in that building or in the area. So there was, quite a few upset people. But what really struck me is, and now I don't have the perspective of the hospital administration or things like that at that time, but that day, how everyone came together at Stony Brook. The hospital was emptied very quickly, to potentially treat people. Everyone kind of was mandated to stay, but it was the first time I guess I had experienced a potential mass casualty event. And it seemed like people were generally working together, in the time of need. And it's something that really stuck with me. As we know, unfortunately, our services were not needed. But probably only other time I've seen anything close to that where people come together working in a time like that was actually during the recent COVID pandemic, when many of our residents were called on to man the COVID wards, people redeployed to different units. So it was kind of nice to see how everyone could actually work together. A lot of the interdepartmental or inter-service bickering, that all went away, and people truly tried to work together. In terms of my most memorable mentors in medical school, there are actually two urologists. One was Dr. Zelig Fischer, and one is our still current chairman, Dr. Wayne Waltzer. I remember my first surgery with them, it was a kidney transplant, and just to see how they can affect someone's quality of life from putting in a new kidney, seeing the blood vessels get reattached and make urine was just such an amazing experience. But more than the technical ability, I think they were both real gentlemen surgeons. Everyone respected them. Everyone liked working with them, and it was just very refreshing to see. And I think that's one of the reasons I came back to Stony Brook, and I'm very happy to be here. Yeah, thank you.
Thank you so much. Thank you so much for sharing your experiences, Dr. Kim. And next we have, I'd like to hear from Dr. Angela Kukosis, class of 2005, Associate Professor of Surgery and Program Director of the Vascular Surgery Residency. Dr. Kukosis?
Yes, hi, thank you. Thanks for the invitation. It definitely prompted me to think about my experience at Stony Brook. And it's interesting, I didn't really realize until now the impact that the medical school had on me in my career. So, my story is not unlike many people. You go into med school, you think you're going to do one thing, and by the time you go through your years, you realize, no, I don't know what I was thinking. I'm definitely doing something else. Well, I went into Stony Brook thinking that I was going to be a hematologist oncologist. And it was interesting because one of my favorite professors is Jack Stern. But then I realized after meeting the cadavers that I thought I could never be a surgeon. So I immediately dashed that out of my head. I proceeded through medical school, first year, second year, third year comes along, and it was still the traditional. And that's another big change. First year and second year were dedicated class time. And it wasn't until the third year that we had the clinical exposure, which has vastly changed now. So it really wasn't until the third year that I explored all the specialties. Again, thinking, I'm going to do medicine, I'm going to be a hematologist, that's that. I know exactly what I'm doing. I happened upon my surgical clerkship, and I was fortunate because the years that we were medical students, we actually got to rotate on almost every surgical service. So it was 8 weeks, and it was 8 weeks of practically everything. So I got to see a real good breadth of surgery. At the time, Stony Brook had a fairly busy vascular surgery department. And honestly, I didn't even know what vascular surgery was. I didn't know it existed. And a lot of that still exists today, unfortunately. We're trying to change that. Stony Brook was one of the first institutions to have the first vascular surgery residency program. And there were only 6 hospitals in the country that offered it. So it was my experience at Stony Brook that really changed my life. It steered me completely away from medicine into surgery, into a specialty I didn't even know existed. And if it wasn't for my mentors there, I wouldn't have even known there was a pathway into it directly from medical school. Fast forward, those experiences gave me the goal of becoming eventually program director and being heavily involved with medical students and vascular residents. So I'm really happy and honored to be in this position, and I wouldn't be here if it wasn't for Stony Brook. And I really say that with pride, because I think back then, and I hope less so now, people really thought that Stony Brook medicine, the medical school, was the underdog, I mean, it's just a state institution. You know, you graduate with a Stony Brook medical degree, so what? But Stony Brook was one of the very few that had the opportunities that most other Ivy League centers didn't have across the world, across the country. So I just wanted to emphasize how great Stony Brook really is. It's one of the reasons why after I completed my training in a different institution, I came back as an attending, and I'm proud to be here.
It's incredible. Thank you so much for sharing your experience, Dr. Kukosis. Our next presenter tonight will be Dr. Patricia Eng, class of 2012. She is an assistant professor of clinical medicine, primary care track director, associate program director of the internal medicine residency program, and she is our next speaker now. Dr. Eng?
Everybody, thanks so much for having me here. And I guess as one of the more junior alum, I just want to thank all the faculty that are here who are part of the process to help me to become the physician I am. When I was invited, I was trying to reflect what are some of my favorite memories of being a Stony Brook student. And I have to really highlight the extracurriculars. Of course, being a student here, we do really well preparing us in the classroom on our clinical rotations, but it's also just the kind of student interest groups as well as the other extracurriculars that has really helped me. And the ones I wanted to highlight was one, SB Home, which is our student-run free clinic. I think it's amazing that us as students, have this clinic to help take care of uninsured and underinsured patients. So we were able to get our feet wet very early on as first-year students, seeing patients, working with our senior classmates and taking care of patients with really complex psychosocial issues and chronic conditions. And with SB Home, that was one of the first clinical experiences that really helped inspire me to become a primary care doctor. And now back as faculty, I try to volunteer as a preceptor, and it's really amazing to see how the clinic has evolved in the sense of the patient charts used to be paper notes that we would carry in boxes into clinic. And now the students have figured out how to get an EMR and, actually do everything via the computer. And also how interdisciplinary it is now. I know that social worker students will come in to give patients resources and counsel them. Also, we have undergraduate students at SB Home that help with translation. And I think a lot of them are pre-med too, so they can have some education around that. So I think it's really cool to see how SB Home has evolved since I was a student and there. The other things I wanted to highlight was just Asian extravaganza, as well as Evening of the Arts. And I'm actually going to change my background to show an Asian extravaganza picture that was from our Bollywood dance. And I think I was always just incredibly amazed of how talented my classmates were. They just really seemed to be like professional dancers, singers, and we're studying so many hours in the library or at home, but yet we would come together doing practices in the Galleria. I think during fourth year, because oftentimes Asian extravaganza and Evening of Arts were around the similar time, we would have hours of doing Bollywood dance, then we're doing the hip hop dance for Evening of the Arts. And I have to say, I think that was probably when I had the best sort of aerobic activity of all time of participating in that. And I think it's really cool that both of these events have, kind of continued throughout the years. I know with the pandemic, things have been on pause, but we'll have a, announcement later that we're trying to bring back Evening of the Arts later this year with the 50th anniversary. And I look forward to, seeing what the students can bring out and also hopefully faculty to participate. So I'm just so thankful that Stony Brook not only helps us grow our brains with knowledge, but also creates it with creativity and sort of humanities with all these extracurriculars. So that's what I wanted to talk about. Thank you.
That's amazing. Thank you so much, Dr. Eng. And next we have Dr. Marshall Leonard, class of 2016, clinical assistant professor of emergency medicine. I believe you stayed at Stony Brook for your residency after you graduated. Can you tell us more about a memorable experience while you're here?
Oh, yes, I would love to. Thank you for inviting me to come and represent kind of the time period I was here, and seeing all the familiar faces is just a kind of a great thing to bring me back pretty quickly. There's a pretty an experience that I had throughout medical school pretty early on that really kind of has stuck with me throughout my career so far early on in the attendingship as well. I joined Stony Brook as a non-traditional student. What that means is I was out of college for probably approximately 10 years. Within those 10 years, I played professional soccer, so completely away from academia. I was married. I had 2 children at the beginning of my first class of medical school. So as you can imagine, when I began, I was pretty hesitant, nervous, unsure if, did I have what it would take to kind of go through medical school with everything else that kind of came along with what I had in my life at that particular time. But I want to highlight the faculty and the teachers and all the support staff that was actually provided to me, but as well as all the students that in my class. And so I just want to touch a short story. In the early, my first year going through, pretty grueling classes. This was in 2013 in the spring. I kind of was away from home. I thought Boston was my home. I lived there for about 10 years playing soccer. And on a team there, you kind of create really big bonds. You kind of are a family. You're always in the locker room together. One of my best friends, Matt Reese, was a goalkeeper that I played alongside. And it was, if you've ever been to Boston or if you guys have lived there, the Boston Marathon is pretty much a sacred time for everybody up there. Businesses are closed. Everybody is out on the streets watching. So it was a tradition of mine for myself, my wife, to go with him and his family, his parents that were usually come from California, to watch this event. So when I came to Long Island, I was actually kind of away from home, you would say. And during that year, he invited me to come back up to take part in the same tradition we've had every single year in the past. And at this particular time, his wife was actually going to be running in it and supporting the Robert Kraft Foundation. His parents were visiting him. And unfortunately, fortunately, I was taking a cardiology exam during that time. So I opted for myself and my wife. We weren't going to go up there, and I was studying instead. So obviously what happened during the Boston Marathon, he was actually at the finish line. His wife was about to finish about a mile away when his 6-year-old son said he wanted to see his mother at the finish line. So he walked about 50 yards away, and 30 seconds after the bomb actually hit, he handed his 6-year-old son off to a random restaurant owner, and he ran back to his parents' side, finding his father on the ground, severely injured. He used his belt to apply a tourniquet. And fortunately for him, he was emergency into surgery, and they saved his life and his leg as well. But unfortunately, after that particular time, they were displaced for probably almost 6 months. And so I was lost in this particular time, meaning that I really wanted to be with him, be with family, and I didn't really know what to do. So my wife and I decided to kind of do whatever we could. And we tried to raise a little bit of money for his family and his wife, who was going to be there in a hotel for the next whatever particular time for him to recover. My class, we made T-shirts. My classmates in my class supported me fully, getting T-shirts. We were running around campus in support for him and his family. And one of my faculty, one of the teachers that I have, I want to highlight, Dr. Iris Granick. She emailed me just kind of out of the blue saying, come to my office. And as you can imagine, I'm an older student. I thought I was in trouble. I'm going to the principal of the teacher's office. I went up to her office and she sat me down, and the words of encouragement, just the wisdom that she had, and just the presence that she gave me in that short 5-10 minutes is something that I hold very dearly to me. And I've really continued to kind of hold on to throughout my life and my career. And she went a step further by purchasing a T-shirt. But she went into her purse, she got a checkout, and she wrote a donation to this cause that she didn't know this family. She knew me as a student, and something that I've never had somebody do that for me before. I was able to give this to the family, and they were just over the moon with what was provided by Stony Brook Medicine. So I just want to highlight Dr. Iris Granick is one of many of the teachers that we've had at Stony Brook that just support not just us teaching and knowledge, but just the surrounding thing of just a student that was 10 years removed from actually any sort of college experience, but being able to support the life outside of just the knowledge of medical school. And so I was away for a year after my emergency residency at Stony Brook, and coming back, I've just really am continuing to be involved with the medical students, with the undergrad side. And, it's partly because of or probably 100%, because of the faculty that I had during my medical school. So I just want to highlight that seeing all this from the 50th year is just a beautiful time for me to kind of reminisce. So I I look forward to seeing some of my classmates in a little bit of time. And I thank you for letting me share a little bit with you guys.
Thank you so much for sharing that with us, Dr. Leonard. And lastly here, we have our most recent graduate, Dr. Justice Okanu, class of 2021. He's Assistant Clinical Instructor of Orthopedics and a second-year resident in ortho. Dr. Okanu?
Hey, good evening. Yeah, I'm still a resident, so keep this brief. I don't really have much to reminisce on, but I just wanted to focus on kind of how it's been like a sense of community that kind of kept me here. Everyone's kind of touched on most of the educational parts of this, but I want to focus more on the intramural sports. A lot of us played together, whether it was basketball or kickball, anything really. We kind of came together after studying countless hours, being in different kinds of classes we were in, just to spend time together and to have fun. And we won a lot. We actually have our team name up in the rafters in the undergrad gym, and we had a lot of our attendings come out to play with us. I don't know if I can share my screen. I have a picture. Let's see. Oh, I can't really share it, but it's this picture where we were out playing soccer, and it was Dr. Wackett actually came out with us to play. And that kind of system kind of permeated to kind of how medical school education was changing. We started to have a lot of more small groups where the classroom was flipped, and it would be more problem solving in a team based effort. And I know a lot of the time back in the day, it was more lecture based, but I guess most of us aren't really fans of lectures. More fans of working in groups. We get our studying done on our own. And then another recent thing was graduating early in 2020. We actually graduated about a month and a half early. We had the option of sticking around to work some shifts because of the COVID pandemic, and that was really a great experience for me. We kind of jumped into the unknown to kind of fight a virus that we knew nothing about. But it was, again, me, the people who I'd been with for the entire 4 years, and older people who are further around in their residency to help guide us along and kind of help out with everything. And kind of keep that sense of community and teamwork with me as I with anything I do. In the operating room, it's all about teamwork. We work with our patients and et cetera. It's all a group effort to kind of achieve that goal that we want. And something that I'll be keeping with me today and into the future. That's it. Thank you.
Thank you so much, Dr. Okanu, and thank you again to all of our panelists for sharing your experiences and for staying on time. You gave us a wonderful walk down memory lane, and I really appreciate everyone being here. As for me, I will be graduating this May and hopefully will be matching into diagnostic radiology. I think it has been great to hear where the school started and how far it's come in the last 50 years. I can't wait to see where it goes in the next 50. So thank you all for joining us this evening. And for those who are interested in continuing with reminiscing in breakout rooms, we'll open them in just a minute. I want to thank Dr. Dorothy Lane as well for planning this event. You will receive your CME credit via email from her office. Lastly, the 50th anniversary community would also like you to save the date for Saturday, May 14th, for our end of year celebration with Evening of the Arts, which will be followed by a reception. This will take place in our new Mart building, which is adjacent to the hospital. If you'd like to perform or have art that you would like to show, let us know. And for further information, you could check out the new 50th anniversary website for history events. And we'll also be posting about our What the Health podcast and oral histories very soon. All right, so thank you again. We'll be opening up the room soon.